I am Dr. Muhammad Yasin from Darbhanga, Bihar, working as a consultant neurologist in Paras Hospital. And today we will talk about epilepsy. There are very confusing terms and there are very misnomers propagating in the community or society. These are in the most abundant or most famous are that epilepsy is a disease or illness which never cures, but it is totally wrong, because the nowadays epilepsy is treatable by various medicines or sometimes required surgery, and it has a complete cure. Sometimes people's thoughts about that the epilepsy is a communicable disease and it spreads by touching someone or through mothers to baby, but it is also not true. It is also a myth, because the epilepsy is not a communicable disease. It is not a spread like COVID infections, and sometimes people become very afraid when he or she watching a epilepsy. So don't be afraid while watching a person with epilepsy, and the utmost requirement of that patient is the help of the bystander by doing a proper positioning of the patient or immediate calling to the emergency ambulances, or take the patients of epilepsy to the doctor. And there is a thought that the treatment of epilepsy should be continued for lifelong, but it is not so. It takes about 3 to 5 years, and instead some patients require much lesser treatment. Post-traumatic epilepsy required treatment for 6 months or less than that, and patients may get fully cured. Yes, of course, some cases are genetic or associated with a structural epilepsy. So the patients presented with a structural epilepsy needs some surgery, which is now as of is doing well in every nearby good hospitals. So the motto of my talk is, don't be afraid from epilepsy. It is a curable disease, and but the patients with epilepsy requires our support or supports from the community, and the immediate help which can be provided by the bystander, by a common people, and needs awareness in the community. Thank you.